Sorry, hey, I need to speak to a pharmacist ASAP. I got something going on here. I really need to talk to a pharmacist.
No.
Is there a pharmacist here?
Yes, there is pharmacist. Okay. Just calm down.
Are you the pharmacist?
I'm not the pharmacist.
Okay, I need to see someone.
No problem.
Please, I'm sorry.
Just calm down. Calm down. Right. Don't worry about it. There's a room over there. Just go over there, have a seat. I'll send the pharmacist as soon as possible.
Okay.
No problem. Right. Calm down. Okay. Sorry about that.
Hi.
Hi, how are you?
Not good.
My name is Pouria Nia. I'm the pharmacist on duty.
Nice to meet you.
And your name is Dani, right?
Yes, that's me.
Can I verify your date of birth?
5/15/85.
I see. So, what is the problem?
I got this weird thing growing on my stomach here, man. I don't know what it is. I think it's cancer, some tumor thing. Probably gonna die.
It's most likely not cancer, but let me go through your medical chart, okay? Let me do your file, and then we figure out what it is. Danny, I'm going to ask you a few questions, and I'm going to write them down. Is that okay with you?
Yeah, that's fine.
Okay. I reviewed your chart, and I see that you are on insulin, right?
Yes.
Tell me about it.
Well, I inject, insulin once a day in the morning.
How many units do you inject?
40 units.
Okay, and where do you inject them?
Check them right here, right in my stomach. That's where the doctor told me.
I see. Do you always do it at that point?
Yeah, like right here?
Yeah.
Yeah, I always put it right there in that same spot.
I see. So the condition that you have is medically called lipodystrophy. Okay?
Lipo what? It sounds like cancer.
It is not cancer. It is just accumulation of fat tissue on the spot that you always inject your insulin.
Are you serious?
Yes.
So I'm not going to die?
You are not going to die.
Thank you, Jesus.
Danny, on your medical file, I don't see that you are taking any other prescribed medication. Are you getting any other medication from any other pharmacy?
No.
How about anything over the counter or edibles?
No.
Okay.
Take nothing.
I see. Are you taking your blood glucose?
Check it, yeah, check it.
How often do you do that?
Probably, every day, if I remember, you know what I'm saying?
And what is the range you usually get?
Like 140, 150, sometimes 160.
I see. Okay, Danny, I have some materials here for you. I wanted you to show me how do you administer your insulin.
Can you
just show to me?
Yeah, I got the insulin. What's this? Yeah. You got this, take the needle, take the cap off, put it in. I flip it over, I take my 40 units, put this down, and then I stab it right in my sweet spot right there, put my 40 units in, pull it out, I throw this in that red thing, that red container I got at home. That's pretty much it. There's nothing much to it, right?
Okay. Okay, Danny, based on what you showed me, there are few steps that you're missing, okay?
No way.
Yeah.
I'm doing it now. I'm not doing it right?
No, you're not doing it correctly. No. Now, I'm going to show you how to administer insulin properly, okay?
Please.
Before you do, you have to make sure that you have your insulin, you have your syringe, 2 alcohol swab, and your Sharpie container, okay? Now, what you are going to do, you're going to grab your insulin. If it's a brand new insulin and you're grabbing it from fridge, make sure it is not cloudy. If it's cloudy, you have to warm it up.
Yeah, I usually pop it in the microwave like 10-15 seconds. It gets nice and clear.
Yeah, don't put it in the microwave, okay?
No way.
Because these are plastic and may melt, and it's also denatured insulin, okay?
Oh,
so that's very wrong.
Supposed to do that?
You are not supposed to do that.
I thought the doctor told me to do. Man, those doctors.
No, don't do that. Okay, what you're gonna do, you're gonna roll it in your hands 10 to 20 times to warm it. Okay?
That warms it up?
It will warm
like
it up.
That?
Yeah, just simple thing. You just put it there, you just roll it 10, 20 times, it's ready.
Okay, I got you.
Then grab your alcohol swab. You're gonna clean it up and wait for air dry. Okay?
Oh, we gotta wipe it, huh?
Yep. Grab your syringe. Be careful about these. These are only single use. You are going to use it just once.
Oh, yeah.
After that, you have to dispose.
Yeah, I usually do that.
Okay, perfect.
I use it one time.
Yep, and make sure it's the insulin syringe. Okay.
Oh yeah. Yeah, I got those.
There are gauges on it that shows you how many units you are going to inject yourself.
Yeah, I do 40. I do 40.
You do 40. Okay, what you're gonna do first? You're gonna pull out air in the syringe, 40 units. Okay.
But what do you mean pull out air?
Just put the air in the syringe.
I'm supposed to pull that out before I put it in there?
Yep. And then what you're going to do, you are going to inject that air into your vial. Inject it, flip it over, and then draw back the insulin. Do it slowly and make sure there is no bubble inside. If there is bubble, just push the insulin in and draw it back again. Okay? So if you do it very slowly, there will be no bubble in it. Okay, now you are going to flip it, take the syringe out, and just leave it on the table. Make sure that the needle doesn't touch anything.
Okay.
Okay. Now you are going to grab your second alcohol swab. You are going to clean the area, the place that you are going to inject it. You are going to start from the center, and then in a circular motion, you clean it. Let it air dry.
Okay.
Okay. And then grab your insulin, pinch the area, inject it in 90-degree angle to the skin, and then very slowly push the insulin in.
Okay.
Wait for 10 seconds.
I gotta wait there 10 seconds?
Yep. You have to make sure that all the insulin
I don't pull it
goes
out
in.
right away.
No. So after 10 seconds, you're going to pull it out, and you are going to dispose it in the safe shock container. Okay? Make sure that you are not mix it with the regular garbage.
Yeah, I usually put it in there.
Okay, and make sure that you are rotating the sides. Okay? So when you are administering it, make sure that, for example, you do it today here, tomorrow here, around your, belly button. Okay?
Okay, so different places, huh? Every day?
On your abdomen, yes.
I got you.
Thigh is a good part too. You can put it on your thigh,
I remember
or you can put it, in
I'm
your
more
abdomen.
comfortable doing it here, so I think I'll stick
Just
with
make sure that you.
But I don't want this thing to happen again.
That's why I'm telling you that you have to rotate the sides.
Sideways.
Yes, because if you always do it at one part, it's gonna create those, extra fatty tissues around it. That's why it looks, abnormal.
Okay, I got you.
So then you can throw all other stuff, the caps, the swabs, in the regular trash can. Okay.
All right.
Now, so do you understand all the normal procedure of, injecting insulin?
Yeah, man, you pretty much showed it to me. I mean, I think I know what I'm doing now.
Okay.
Now I can tell I was doing some stuff incorrectly, but.
Yeah, but now you should be fine.
I know what I'm doing now, so no microwave, and I think I know the procedure. Thank you for showing me how to do that.
You're welcome. Now I'm going to call your doctor. I'm going to talk to him about what we have done here. I'm going to talk about the problem that you have.
Okay.
And I will try to get a follow-up visit, for you. So probably they will call you and set an appointment, okay?
Yeah, that's Dr. Morroe, my doctor.
Dr. Morroe, okay. Yeah, I have it in file here. I saw his name that he wrote the insulin for you. Perfect. Before I let you go, do you have any questions?
Well, there is something I want to tell you. I've been having trouble in bed. Haven't been pleasing my wife. You know what I'm talking about? She's been complaining. So I want to see if you can hook me up with those Viagra pills. You know what I'm saying? Like under the table.
I would love to help you with that, but I cannot. I'm sorry.
Come on, man. Right over there.
I'm sorry. I know, but I cannot. This is what I can recommend. When you go to visit your, the follow-up visit with Dr. Morroe, what you can do, you can ask him, you can tell your problem and ask him to give you a prescription. Okay. And then you can bring your prescription here. I will be happy to fill it out for you.
You'll fill it for me?
Yep.
All right.
I'll do that for you.
So you can't, you know what I'm saying?
All right, so I would love to, but I cannot.
Okay. All right. That's fair. That's fair.
Is there anything else that I can do for you?
No, that's it.
Okay, Dani. You're all set here. Thank you very much for coming.
All right, thank you for showing me, man, helping me out. I appreciate it.
You're welcome. Your doctor will call you. I'm going to call your doctor right now, and then he will contact you, okay?
Sounds good. Thanks a lot.
Take care. Have a good one. Bye.
Dr. Morroe's office.
Hi, my name is Pouria Nia, and I'm calling from MCP Pharmacy. I'm calling regarding patient Dani Maria. Can I talk to Dr. Morroe?
Okay, before I get Dr. Morroe, let me pull up the patient's medical record. You said it's Dani Maria, and What is the patient's date of birth?
Yes, date of birth is 05/15/1985.
Okay, I found the patient. Let me go ahead and page the doctor right now.
That's fine.
Dr. Morroe, who am I talking to?
Hi, my name is Pouria Nia, and I'm the pharmacist at MCP Pharmacy. I'm calling regarding patient Dani Maria.
Oh, okay, Dani Maria, I remember him. He's a nice guy. And what is this call about?
So today Dani came to my pharmacy and he was complaining of lipodystrophy. And I noticed his blood glucose is not controlled with his insulin. So I showed him the proper way and the proper technique of insulin injection, including the importance of rotating sites.
So what appears to be the problem? How can I help you?
Dani is on Lantus, 40 units sub-Q daily. He has been taking it for 4 months. But it seems that his blood glucose is not under control. He told me he's averaging around 150 milligram per deciliter every day.
Oh, okay, that appears to be a little bit high. I thought we had him under control with 40 units over the past 4 months, but it seems to be not working as good. What would you recommend in a situation like this?
I recommend a follow-up visit in 2 weeks for a re-evaluation to check his blood glucose in the office. At that point, if Dani's blood glucose is still high, I recommend to increase his insulin to 60 units daily. I also suggest switching his insulin prescription to a pre-filled insulin pen, such as Lantus Sol Star, also 60 units sub-Q every day.
Alright, that sounds like a good plan. I'll just have my secretary, schedule an appointment, have him come to the office, we'll get some tests done, and then, after 2 weeks, see how he's doing then, and then perhaps do as you said, increase the insulin or switch him to a pen. We'll see which one's more effective and what he'll like more. But anyways, thank you for the call, and thank you for taking care of my patient. Have a good day.